Hi everyone, I'm Dr. Sudhanshu and today we'll talk about what is the hair transplant recovery timeline. That is a very important question which a lot of patients ask us. I'm Dr. Sudhanshu from Divine Aesthetic Surgery and today we'll talk about this very topic. Say you get your hair transplant done today. What can you expect in the future? How things are going to heal? When will you see some growth? When will you not? This is what this video is for today. So say you get your surgery done today. For the first few days, which is around 4-5 days, you can have a bit of discomfort on your scalp where the procedure has been done. You are given some antibiotics and painkillers so that this problem becomes much better and more manageable. But majority of people don't require a lot of painkillers or anything. But we do suggest that you do need to take your antibiotics for 5 days. After this point, you will notice that you will have some sort of redness, some sort of swelling in your scalp, the donor area as well, where you have done the hair transplant has been done from. So at this point in time, we do suggest you to lie down straight onto the pillow. You can lie down despite the donor area being used for a transplant, and then of course you get back to your work. You can drive, you can climb stairs, you can actually go back to work as long as you don't have any exertional work to do. So after this much time, which is about 5 to 6 days, you can completely join back your work. So after this main time, the first 3 months is when जब आपके बाल initially गिरेंगे, which is the falling phase of the hair. जितने भी आपके बाल लगे हैं, all of them are going to fall. Now by that I mean is the hair shaft falls. The root will stay in the scalp. And this is what has been transplanted. Irrespective of what procedure is done, is it FUE, is it FUT, is it long hair, is it an untrimmed one, every hair transplant will have this phase, and it is very important for this to happen simply because, as you know, hair are living things. They need that time to go into resting, get more energy, and then finally start growing. This is an average time. This can be around 3.5 to maybe 4 months in certain people. कई लोगों में ये हो सकता है कि एक जगह पहले फॉल हो रहा है और एक जगह बाद में, एक हो सकता है कि सब जगह पहले फॉल हो रहा है और पैची भी हो सकता है, which is individualized to every different person. After this, the second time frame is 4 to 6 months, जिसमें आपके hair growth actually शुरू होती है, which means जो बाल पहले अभी सो रहे थे, रेस्ट कर रहे थे, they all start growing. So in this 4 to 6 months time, these hairs which have rested completely now, will start to grow. They'll sprout, and you'll see some growth like a buzz cut for most patients in all of these areas where the transplant has been done. Again, this is not going to be your full result, and it is not even matching the density which has been given to you. Now, why I say this? Because I'll say in grafts, there are multiple follicles. At this point in time, it's only just 1 or 2 follicles which have actually grown. Others will take time. After 6 months to 9 months or 10 months, for varying for every person, this is when the density also starts to improve, and this is the time when you'll see a substantial growth in your hair as well. And at the end of 10 months or 11 months, again very different for every person, this is time when we say कि आपका result अब final हो गया है. This is the time when you'll see कि आपके सारे बाल grow कर गए हैं, उस density में आ गए हैं जिसमें उनको transplant किया गया था. Now, your entire timeline from the day of surgery till end will take anywhere from 10 to 11 months. So, बहुत लोग पहले distress में आ जाते हैं कि हमारे बाल आ नहीं रहे, it is not as dense as मैंने सोचा था, but unfortunately, the hair need that much time to grow, which is this time. And what we can do to make all the entire growth better. So at Divine, our policy is to give you something called as PRP, which is serum created from your own blood. Now PRP or GFC, one of the two, is always given every month for the first 5 to 6 months. इसमें बेसिकली क्या होता है कि जितने भी आपके न्यूट्रिएंट्स आपके बॉडी में हैं, वो आपके हेयर रूट्स को डायरेक्टली मिल जाते हैं, विच मीन्स आपके एग्जिस्टिंग बाल भी अच्छे से ग्रो कर सकते हैं और जो नए ट्रांसप्लांटेड बाल हैं वो भी अच्छे से ग्रो करेंगे. And this is the only medication we suggest you need. There's another multivitamin which we do suggest कि आप लीजिए, simply because your diet needs to support all this growth which is happening. So growth of the new hair and the healing of from where the hair have been taken. You can only heal better if you are healthy yourself, hence the multivitamins. Once your medications are over, it's best suggested you do some sort of physical activity so that your blood is well flowing into your scalp. Have a healthy diet and have a healthy lifestyle, because as you all know, healthy lifestyle means healthier growth of all parts of the body, especially the hair. So in this video, we just spoke about how and when you will see changes in your hair growth, what you can do to make it better. Another thing for this is that if you are a smoker, it's best to avoid nicotine in any form, because in general nicotine will not help in any growth. So if you want better hair, you probably might want to need the smoking or vaping, whichever you do. For any other doubts, please do contact us.